by a gentleman that I interviewed during this project. I felt that it was relevant to this project because the project is centered around the human-centered design process. And so the human-centered design process is a process that engages the patient or the users and their feelings around a problem that they feel should be that impacts them. And so one of the gentlemen that I interviewed mentioned to me that he has the health insurance Medicare. And as for some of you that don't know, Medicare is for the ages of 65 and older. And so he mentioned to me that Medicare, he feels that Medicare doesn't care about him. They don't provide services within a timely manner, and they never give him resources within a timely manner. And so that brings us to our project, which is accessibility to health insurance. Our team name is Easy Health, and my name is Espinoza.
My name is Robanjeet Singh.
And I'm Esau Romero Luna.
Okay. And so the problem here is healthcare. The healthcare doesn't provide accessible resources within a timely manner for the low-income patients. Many of the low-income patients that we spoke with told us that the process is too complicated. And so we realized when we first started this design or this project, in our first conversation around the human-centered design process, it led us to discussing the accessibility with healthcare and how it impacts the low-income community. The low-income community has a high lack of knowledge for their coverage and difficulty in finding doctors and resources within a timely manner. As we did a few surveys during this project, we sent out some surveys within the Riverside, Sacramento, and Santa Clara County. We did it within the low-income community and found that there's a high diversity within the culture. And so we realized that this brings a high demand in translation and also brings a big gap in communication. On our second survey results, we found that the majority of the responses do not know how much their insurance covers and where it can be accepted. For many patients that are part of the low income, if something serious happens, how do they know if they're completely covered? And so this brings a lot of discomfort to the low income community because their knowledge within their healthcare provider is low. And this proves to us that the lack of knowledge is high, and there has to be something accessible and easy to show the low income where to get their resources. And so this brings us to our interviews. In our interview process, I spoke with a lady by the name of Rosalie. She discussed with me that her healthcare provider should provide more coverage for emergency care, because for her, being part of the low-income community is too expensive to cover, and if something all of a sudden happens, the cost would be too hard to cover. To me, this is crucial, and the low-income community should have these accessible resources to be able to choose a affordable health insurance. Robanjeet will also explain about her interview.
Yeah, so my interview was Abby, and she responded that she does not agree with the process of getting healthcare is easy. Indeed, she mentioned that it's difficult and time-consuming, but she likes that her doctor speaks her primary language. And we have another interviewer named Luis.
As you heard from my classmates, the healthcare, it's a huge issue. There's problems before you go into the hospital. There's problems while you're in the hospital. And as I was speaking to Luis, he was telling me how he enjoys every time he goes to the hospital. He has very good doctors that take care of him. The only issue is that follow-ups are sometimes unclear. He doesn't know what to do. In case he has questions, he doesn't know where to ask. So this is a huge issue just as the healthcare overall. So Ray is going to actually explain how we're planning on fixing this issue.
Right. And so our solution is to bring a single platform that bridges many resources onto a single platform. As many of you may be thinking, there's already many apps and resources or websites that are tackling the same issue. The issue is accessible resources within a timely manner. And so they have the Kaiser app, they have the homepage for many different hospitals that provide resources for patients, but they're not on a single platform. And so we want to provide low-income patients with resources in a timely manner that's easy and accessible. And so that brings us to our initial prototype, as Isael will explain.
So as Ray mentioned, our initial prototype is going to be a website. In this website, we are going to have a filter map. This map is going to ask for the county you're living, the insurance or lack of insurance, and your preferred language. As we are tackling low-income communities, we figured that the best way to talk to this diverse community was to talk to them in their own language, something they feel comfortable. We want to come to bring patients and doctors together so that patients don't feel like the health providers don't care about them. Um, this map will be able to show locations where you can get the services. You can go to hospitals and clinics that will take your insurance or your lack of insurance, as well as be able to speak your preferred language. We also have a future where we want to create a community. We figure that low-income patients don't have a voice. We want to give them a voice, and the best way to give them a voice is to have a community where they can tell us their concerns. They can tell us if they need help, if they need resources. This community will also serve as a support group where people within the community can talk to each other. It is an open forum, but we are keeping it as professional as we can. Um, you don't have to become a member while using the website, but we do encourage people to join the community so they can have access to all the resources. They can have people to talk to. We're hoping to release this website in the near week, but this is just the beginning. We have a huge vision for this website. Next, please. Um, we're creating this website so it can adapt and change as time moves forward. I know with this pandemic, things have to be a certain way, but once we get out of this pandemic, there will be another issue that we need to tackle. So we're creating this website so that it's able to adapt to anything that comes into it. Some of the features we're looking forward to are Rate My Doctor. There's already a Rate My experience in almost every clinic and hospital out there. But as I mentioned before, we want to hear from the low-income community. How's your doctor doing? Is your doctor doing what it needs to be done? Do you recommend your doctor? I know people have a hard time communicating with doctors, so this will be the best way to make sure that they're giving their best health care they can give. We also want to provide a 24/7 hotline. It will both be automated, meaning simple and easy questions could be answered by a robot, or if the questions are complicated enough, we will get a healthcare professional in there to answer any questions that come up. From our interviews and surveys, we did figure it out that waiting in line is one of the biggest issues with the people we talk to. I know when I go to a hospital, I don't want to wait in line to check in so I can wait again to talk to my doctor. Especially in the emergency or urgent care, I know people are frustrated, they're angry, they're sad, they're in pain. We want to keep them from, we want to make sure that they're comfortable and they get out of there as soon as possible. That's what we want to do at an online check-in where we will ask for their symptoms, any history, allergies, and their preferred language. We want to make sure that there's someone there who's there to comfort them and speak to them in their native tongue. Also, live wait times. We want to make sure that people are able to see how long it would take before you go into the hospital, rather than going into the hospital and then waiting an hour just to find out that you're going to be seen in 3 hours. This is the future that we are going to release in the near future. But as I mentioned, this is an app that is designed to change and adapt. So there will be more features added as time goes on. Next, please. As you heard from Ray, there's already apps and competitors and websites out there. So what's new? How we new? Here at Easy Health, we want to provide all those resources in a single platform. We want to be able to for patients to come into our website, find what they need to find as soon as possible, get the service they need as soon as possible. I know many of these competitors have these things that we want to incorporate, but they don't offer it for low income patients. They offer it for their members. We want to provide all of this for them, and they are at the center of our solution. We really care about the low income patients, and we want to provide them as with many resources as we can. The only thing to do this is to follow the next few steps that Robanjeet will take care.
Yeah. So as Esau mentioned that the initial website will be coming up, and he also explained the detailed features. Um, since it's coming up in upcoming days, we actively looking for investors and volunteers who is believing in our ideas and can provide future funding. And that future funding will be covered by having different partnerships with different hospitals. For example, having their wait time for the ER, transitioning from a website to creating an app. Once we launch the website, we are inviting people to commercials that will be presented in the DMVs, county facilities, and further into different medical clinics. Indeed, that way people will be able to join our community and our website. For the final goal, our website will be further accessible to Android and iPhone app. It will be free of charge, and the app will consist with the features that we discussed previously, and it will be directly similar to the website. Our app will be named Easy Health, as our team is. And for now, the phone users can still access the website, but it will be by Google search. Some of the takeaways after completing the Idea Accelerator program is that we grow as a team, we work together, we learn doing healthcare research, asking critical questions to each other, understanding the healthcare and the impact that it has to low-income communities. More importantly, the lack of knowledge, lack of resources is directly affecting different counties and their low-income communities. Indeed, we understood how important it is to have the feedback of diverse population and their different point of views. Indeed, they feel uncomfortable, unclear to access their healthcare. So now we will go for a small demonstration for the website. While we're going for a demonstration, you can ask questions.
I had a quick question to clarify. Is one of the demographics you're looking at just for 65 plus, or is it all ages in that community?
It's directly for low-income populations, so that can be variety of ages, cultures, depending if they are low income.
Thank you.
And this is our website. So we have our logo that Ray might explain the significance.
Right, yeah. So the logo signifies has three hearts, which signifies the three members of our team, and the joining of resources within a single platform.
Mm-hmm. And this is our menu that you can access all the features, or you can simply scroll down. So you can click join our community, and by clicking, you will join our support group. By scrolling down, you will see something or what we believe in us and what the website stands for. And also we mentioned the future features that will be coming, as Esau mentioned. And then the key feature is the finding the nearest healthcare provider. So you will, or the patient will add all the informations, and that will lead to all the nearest hospitals or clinics that they might be eligible with their insurance or without insurance. And then we have also a section where it says, do you know? And this is to awareness for the low income population, where they can have the latest information about COVID-19, county resources, and the insurance. And then at last, we have our pictures to build trust with our community and to connect with them. Thank you.